Hey, welcome everybody back to the channel. Here we come with the topic toothache, the destroyer of sleep. So, you must have heard about toothache. It is medically called as odontalgia, which is the pain in your tooth basically. So, it is due to dental, periodontal or non-dental reasons. Dental means the pain in tooth, right? So, reasons such as those affecting the tooth itself or the reasons which are periodontal surrounding the tooth. There are gums and the bone which are surrounding the tooth. So any problem in that can also lead to toothache, right? The non-dental reasons are more often serious. They are rare, but they are very serious if they occur, such as heart attack, which is myocardial infarction. We'll learn about it later. Or migraines can also cause toothache. So, why does your tooth actually ache? Now, expanding on the previous reasons we stated, like dental. In dental, the first problem could be pulpitis. That is the inflammation in the pulp. Pulp is basically the live tissue of the tooth. It is the soft tissue. It contains nerve supplies and blood vessels in them. So, various insults which act on the tooth, such as mechanical, like trauma, you bite very hard or you chew something very hard, which could lead to mechanical trauma to the tooth. Or chemical insult or bacterial insult, which is basically toothache, the cavities or caries, Rarely it could be change in pressure, which is called as periodontalgia. We'll learn about it later. So most commonly, tooth decay and fracture because of trauma are the main reasons of the pulpitis. It is because the pulp chamber, which contains the nerve sensation and blood vessels, they are encased in a shell. It is a rigid outer shell in which the pulp tissue is formed. So when the inflammation occurs, it leads to swelling of the structures, right? But there is no way this inflammation or swelling could escape out. So it will stay there. It will keep on occurring. It will put a lot of pressure on the tooth itself from the inside. That will lead to pain. So here's what I did to explain it a little better. I took this tooth and divided it into two parts. I separated it both parts, right? So you see this one right here. This is the enamel. It is the hardest structure of the body. It is harder than bones even. So this is the first part. Now the second part, this is dentin. Dentin is a little softer than enamel, and dentinal walls, that is the walls of the dentin, they encase the pulp chamber. So the pulp chamber, which consists of the nerves and blood vessels we talked about, here it lies. Here, right here, So after pulpitis, the stage is of pulp necrosis. Your pulp will be dead. Thus, the tooth will not be sensitive anymore. It is dead. So, if your tooth starts experiencing pain without eating something hot, and the pain becomes too severe on hot and lingers on, you might want to visit your dentist for root canal treatment, as your tooth may be irreversibly inflamed. You'll be surprised to know that in this condition, your toothache may escalate when you lie down, because the blood supply, it increases when you lie down. There will be more blood coming towards your tooth. Local blood pressure in the tooth will increase. It will cause you more pain because more blood, more inflammation and swelling. It will keep on building up inside the tooth, which is locked essentially like this. So it will try to push it as hard as it can, but there's no place it can dissipate to. So it will lead to more pain. Okay. Then there is periapical abscess, which is also called as tooth abscess. When the infection has reached the apex of the tooth, or say apex of the root of your tooth, through the root canals, it leads to inflammation of the apical tissue, followed by an abscess, pus formation. In acute cases, the pain is going to be very severe. It will be very, very severe, lancinating even. You are unable to chew on that side if that occurs. You try to chew, it will be a sharp shooting pain and you will just open your mouth because the pain is too severe. You can't bear it actually. And there will be swelling associated with the tissues, periodontal tissues, that is, you'll see some swelling on gum, it will be tender. Ultimately, tooth will be extruded out of the socket. You will feel like in the arch, in your dental arch, the tooth wants to come out. It will be a little bit raised. That is how you know pus is building beneath the tooth surface. Swelling can also extend to adjacent tissues and involve the tissue spaces forming cellulitis. And it will lead to facial disfigurement. due to huge facial swelling on one side, you will notice. It can also, intraoral tissues can also be affected by it. So let's look at the clinical example. You see this X-ray. This was an RVG done for a patient. He had serious pain in his tooth. He was unable to eat. He was unable to sleep even. So he came to the dental office. I took an RVG, and this is what we find. You see, the pulpal infection leads to pulpal necrosis, and that infection is not traveling through the root canals. You see, these canals, these portions are the canals. Then it reaches the periapical portion, that is surrounding the apex of the tooth. There is bone and periodontal ligament. The ligament is inflamed ultimately, and there is formation of pus around the apex in the bone. So as the pus is developing here in this portion, it will lead to more pressure on the bones. Ultimately it will lead to resorption of the bone and more formation of the pus right here. Because of this pressure, the tooth will extrude out of the socket. If an acute abscess is left unattended, it will change to chronic form. In the chronic form, there will be dull pain, but there will be infectious pus discharge. But the pus will only discharge from a sinus tract formation because the apical tissue is locked in the bone. Okay, so there is no place for pus to go, but it is building up inside the tooth. Where can it go? It will form a sinus tract. It will come out from your gums, but through a sinus tract formation. At this stage, you are at a serious risk for extensive infection in your jaw bones. You must get it checked by your dentist. The treatment is extraction, or if the tooth has enough structure left, you can do RCT, root canal treatment, which is. The next condition is food impaction. Food impaction occurs when food debris, actually fibrous food such as the meats, chicken, beef, anything which is fibrous, it will get stuck between your teeth. The food becomes trapped forcefully because the opposing tooth, let's say the food is being impacted in the lower arch, and the upper tooth is forcefully pushing it in towards the between two teeth surfaces, right? In dental terms, an open contact is responsible for it. That is when there is slight space between your tooth and the other adjacent tooth due to either abnormal interproximal relation, and the opposing tooth forcefully drives food into it. Decay can lead to collapse of part of the tooth, or dental restoration may not accurately reproduce the structures it was supposed to. Then there will be space left between the tooth surfaces, and food will be stuck between them. You must get that checked, right? Because it can also lead to periodontal infections, periodontal abscess even. Gingival papilla will always be swollen in such cases. So it will bleed, it will be tender. Pain occurs during eating. So what can you do in it? Flossing may help in relieving the pressure by removing the stuck debris out of your tooth surfaces. You also need to visit your periodontist because you might have persistent inflammation of the gums, right? Because of the food impaction. You must see your dentist. So the next one on the list is periodontal abscess. As opposed to inflammation and pus formed beneath the tooth root, this is the suppurative infection of the periodontium around your tooth. So it is a lateral abscess. The inflammation will not be beneath your apex, it will be along your root surface. So gum will be swollen on the lateral side of your tooth. In simple terms, this is the pus formation in your gums where gum pockets get deepened more than 4 millimeters. So as the gum pockets, there is a pocket around your tooth. The gum is not attached to your tooth on the surface, you see. It is a little bit deepened, but that is the normal depth. It is less than 3 millimeters. But if it gets deepened 4, 5, 6 millimeters, then there will be chances of periodontal inflammation, right? As your gums are deepening, there will be more food getting impacted between the tooth and the gums. It will again lead to more formation of pus and more infection. So it is although uncommon as compared to the periapical abscess, but still it is severe. It has dull ache, but it is still going to be a problem for you because it is going to cause a lot of irritation. You will have vague pain in your tooth, food will get lodged in your gums, it will be a messy situation. And the pus will drain out of your gums. It is different from periapical abscess as in that abscess, pus was draining through a sinus tract. But in this infection, pus will come out from your gingival pockets. As soon as a dentist palpates them or try to touch them or even probe it, the pus will come out of the gum crevices. So you need to get that checked out if you have that. Next on the list is broken tooth or fractured tooth. So fractured or cracked teeth can cause pain via several mechanisms, including dentin hypersensitivity, pulpitis, which is reversible or irreversible, it depends upon the situation, or periodontal pain again. Accordingly, there is no single test or combination of symptoms, that can accurately lead to a diagnosis. But one of the most used diagnosis for them is when you bite and suddenly lose the bite, it will ache like a bitch. It's gonna ache a lot. So if this is the situation, you're pressing it, there's no pain. But as soon as you open your mouth, there's going to be a lot of pain. So if you have that, you might have a fractured or broken tooth. You might need to get that checked. Okay, let's lead to non-dental causes now. We are going into tough situations now. First one is heart attack or myocardial infarction. You'll be surprised to know that a toothache can be a warning sign of myocardial infarction, MI, which is abbreviated as, also known as a heart attack. The pain may feel like it's radiating outward from the teeth along the jaw, or even it could feel like an earache. Patients with myocardial infarction presenting without chest pain run a higher risk of death due to a misdiagnosis and subsequently a significant greater delay between the onset of symptoms and arrival to the hospital. Orofacial pain is reported by 4 in 10 patients, so it is a fairly common occurring. It can save a life. So if you feel like you don't only have a chest pain, you also have a toothache with it, or a jaw ache or earache, and it's going to your left shoulder or both of your arms, right? And you feel like tightness in your chest, like somebody sitting on your chest, forcefully pushing it down, and you feel like impending death, like you're gonna die anytime. Cold sweats, nervous feeling. If you get all sorts of these feelings, you must get to hospital as soon as possible or dial your emergency numbers because you might need them. Okay. The next on the list is a pain of neurovascular origin, which is through migraines. So you see cluster headaches and your tooth could also ache with them. Sometimes tumors or cancers of maxillary sinus, such as adenoid cystic carcinoma, it is a malignant tumor. It can also lead to toothache because of the suppression or invasion of the superior alveolar nerve. The superior alveolar nerve is the nerve that supplies your upper teeth and your maxillary sinus. So if there is a tumor, cancerous growth in the maxillary sinus, it could also lead to toothache. So you must be, aware about it. So your toothache really needs to be looked at, as it could be nothing or it could be a lot of things. Yeah.